Hi, I'm Paul Van Binder, the Public Health Physician on the Gold Coast. I want to talk to you today about the importance of preparing for winter and the influenza season in residential care facilities. Many of you would have seen media reports about the outbreaks in the north of Queensland. Lurid stories in the Cairns Post about a number of deaths and 60 people all being ill with influenza and other viruses in aged care facilities, and concerned statements from relatives of residents in aged care about the impact on their family and about the adequacy of infection control and other measures. We know that each year there are around 300,000 GP consultations in Australia for influenza. We see about 18,000 admissions to hospital and about 1,500 people will die of influenza. And these impacts are mainly seen in the elderly and are much more severe in the elderly. We know that our vaccine is around 60% effective in healthy adults, but this drops to around 27 to 40% in people over the age of 65. And in residential care, in the very elderly, those living with chronic diseases, those living with frailty, the vaccine is often totally ineffective in these sort of settings. And this problem, what we call immunosenescence, when their immune system no longer protects them against the diseases and the vaccines aren't working, this is really important in residential care facilities because I know that I can't protect them unless I stop them actually being exposed to the influenza itself. In addition to the number of people who will die and be hospitalised, one of the important aspects of influenza is the concept of catastrophic disability. And what that means is that people who are infected with influenza end up being much worse off and much less able to perform activities of daily living afterwards. These are the people in your residential care facilities who are walking around very frail but getting by with a walker, who then get influenza, and we find them confused and incontinent by the side of their bed, and they never get back to the same sort of facility that they had before. Influenza is the third commonest cause of catastrophic disability behind strokes and congestive cardiac failure. And so we need to protect them by making sure that we as healthcare workers aren't bringing these viruses into the facility. We know from strong data that healthcare workers are much more likely to be infected than other people in the community. We also know that healthcare workers spread the virus to their patients, as all infected people spread it, and that they start spreading it a day or two before they even feel sick themselves. We know that if we vaccinate healthcare workers, they're much less likely to become sick themselves, and therefore they are less likely to actually infect the residents in our residential care facilities with the serious consequences. We have ethical responsibility to put the patients first, to do no harm, and to protect those that can no longer protect themselves. Vaccinating staff reduces the impact of influenza in facilities and on the people themselves. It is imperative that every facility has a vaccination policy for their staff. You must provide vaccination clinics at no cost to the staff. You must keep a record of those staff that are vaccinated. There are a number of other issues other than vaccinating your staff. You need to prepare for winter by having an outbreak response plan. You need to make sure that you've been through all of the processes to check your infection control guidelines, to check that you have enough personal protective equipment, to check that you have an influenza plan, to make sure that your antiviral processes are in place, and to make sure that you have a robust mechanism of monitoring your residents and making sure that you identify when they themselves are unwell. We know that in the elderly, they don't have classical influenza. They will not present necessarily with a fever and a cough. And what we do know is some of them present with a worsening of their normal situation, a worsening of their chronic disease. We want you to test during winter any resident that is increasingly short of breath or has a new or worse cough. And we want you to test early. We need to make sure that influenza does not take a hold in your facility. Anybody with a new or worse cough, and if they're short of breath, they need to be tested. If you have 2 or more people with a respiratory disease in your facility and one person who is diagnosed in the laboratory with influenza, you have an outbreak, you must tell public health as soon as you start testing in your facility. It's our expectation that you will have a vaccination plan and a plan to deal with outbreaks. We hope to see detailed plans in every facility to make sure that this winter that we have adequate preparation, that as soon as influenza arrives in the facility, that you are ready to go, that you have your posters to restrict access to the facility, and that we can start antivirals and protect your residents.